During the pandemic, Norwood Community Media and Norwood Hospital formed a partnership and have been producing updates to keep the community informed and provide the latest information. This week, President Dr. Sal Perla announced that the COVID-19 cases are very low at the hospital.
Like most other parts of the state, numbers have come down considerably. Here at Norwood, we're actually a little bit below the state average, and there's a variety of reasons for that. But as many of you know, certain towns and areas had higher numbers in the beginning, and that was us. So now our numbers have dropped off a little bit more than others, and that's just basically because of the time frame. The prevalence of COVID-19 is very low right now. At the peak, we had many dedicated COVID-19 dedicated units, but today we're actually very happy to say we have just a few patients in the entire hospital that are COVID. And what we do is we cohort them into one single unit. All of our units are around 20 to 25 patients. We actually only have 5 or 6 right now, and we isolate them in an area. And the rest of the hospital in the inpatient side is COVID-free. We do continue to have our outpatient testing center. We test patients in our emergency department. We test patients that are admitted to the hospital in a variety of other settings. But overall, again, the prevalence is very low.
Perla also explains why their outpatient testing centers continues to be very busy.
With regards to our outpatient testing center, so our testing center is actually very busy. There's a variety of reasons why. Well, one, we want to continue to promote testing. We want to continue to promote tracing. But most importantly is that we're now really testing the healthy population because they're coming in for those elective procedures, screening procedures, overall general health. So if you're coming in for a hernia that you've been waiting for several months, or any other type of surgical procedure, you will be tested. You'll go through the regular process like anyone else would. There is a standard process that your doctor will review with you, which includes, let's say you have the swab test done on a Wednesday. They're going to ask you to isolate until your test results come back or until your procedure is scheduled. They'll coordinate all of that with you. So we're actually seeing an increase in testing because people are starting to have those procedures that they've been delayed for several times.